Hey everyone, welcome back to Nursing with Bonomi, where we put the page into practice. It's Nurse Nay. Today we're going to talk about blood sugars. So we've received a request asking for some tips relating to how to get enough blood for a blood sugar draw, because some machines require a very large draw. I thought along with this topic it might be a good time to do a practice progress note. So I'm going to describe to you a scenario, and then what I want you to do is think about the scenario, and then in the comments I want you to write your progress note. What I'll do for a following video is look at each of those progress notes, put them up in our video, and kind of discuss some of the things to either improve on or what was great about them. So I'll feature your progress note in the next video that we do about it. I thought it would be a great idea to get some practice, so here's the scenario. It's lunchtime. You're going around to your diabetic patients and getting their blood sugars to see if they need any coverage. This one particular patient has an order to give 5 units of insulin with each meal, and they have an additional sliding scale on top of that. You go to check their blood sugar, and you see that they don't really feel that well. They're a little nauseous, they are a little bit sweaty, and they just don't feel good. You check their blood sugar, and it's only 50. So after you saw that the blood sugar was 50, you went ahead and gave them about 4 ounces of orange juice, and then also a few peanut butter crackers. You check it about 15 minutes later, and it's gotten up to about 68. So at that point you notify the physician, because that was also in the order, to notify physician if the blood sugar was less than 60. You didn't notify the physician right away because you wanted to put an intervention in place first. So you let the doctor know, and he lets you know to go ahead and hold that routine 5 units of insulin that they're supposed to get with each meal. You make sure that the patient gets their lunch tray first. So after they eat some food, you decide to check their blood sugar again, and it's gone up to 86. That's really good. That's your scenario. Write your progress note, and then in the next video I'll feature those progress notes. Now to our request, which is how to get a large enough drop of blood for those glucometers that require it. So here's some tips. What you want to do is dangle their arm down as far as you can get it off the side of the bed, kind of shake it a little bit. You can also put a warm washcloth around their fingers. Let them dangle for a little bit, and then you just kind of milk their finger down like that. See how much more red my finger's getting when I do that? That's what you want to do, and you're going to kind of pinch a little bit until that drop of blood comes out right about there. I think if you prick right about in the middle, you're going to be able to get a larger drop of blood. Ultimately, if you really can't get it, period, you could ask another nurse as well. Maybe they'll have luck. You could try another finger. Sometimes the thumb can work a little better, but yeah, always ask for another nurse for a second try if you can't get something the right way the first time or second time. Always ask for help, and ultimately you might have to talk to the doctor. So maybe they can decrease the amount of blood sugar checks that need to be done. Don't forget to subscribe, and please hit that bell so you can receive notifications when we put a video out. I'm trying to get one at least once a month, so make sure you put the notifications on so it doesn't get lost in all your other subscriptions. Thank you so much for watching. Put your progress notes in the comments below, and have a great day.